Good afternoon, and today on The Men we're joined by Dr. Ross Wines, a highly experienced GP with more than 40 years in family medicine. Originally from rural Victoria and graduated from Monash University, Dr. Ross has dedicated much of his career to primary care with special interest in skin cancer medicine and early detection. Wow, Dr. Ross.
Good afternoon, Nathan. How are you?
Yeah, excellent. Thank you. How are you?
Thank you for inviting me along.
No worries. That's quite the specialty you got.
Thank you.
What kind of drew your attention to skin cancer, and what brought about this, career progression for you?
Yeah, it's a good question, Nathan. That's started off back when I first came into general practice in 1983, when we didn't have much training in dermatology, let alone skin cancer. And I had a patient in his early 20s who presented with lumps in his groin, and biopsy showed that he had invasive melanoma throughout his whole body, and then didn't survive more than a few months.
Yeah.
So, from my early days as a young GP, I felt that every opportunity of me developing the skill sets and the knowledge in skin cancer medicine and early detection has been my agenda.
Yeah, okay. I mean, that's really interesting. You brought up a patient that came with lumps in his groin, but it led to skin cancer. I mean, how did those two things relate?
Well, we didn't know where the primary was, and obviously he wasn't checking his own body for wherever the cancer was, and it had presented with the secondaries in his groin was obvious, but he had metastasis right through his whole body by that stage.
Yeah, okay.
So that's why he died a few months later, because it's already metastatic disease.
That's really unfortunate.
The melanoma is right through his whole body.
Wow, okay. So, I mean, being in Australia, why is skin cancer such a large conversation in Australia compared to other parts of the world?
Well, certainly Australia is the leading country in the world for skin cancer, and it's probably got a lot to do with our Caucasian background, that we are sort of spending a lot of time outdoors and recreation. And certainly the highest incidence of the states is Queensland for skin cancer in Australia rather than Tasmania. But then you look at the amount of hours of sunlight that they have, and the higher index of UV light is highest, and the further you go north towards the equator. So they're spending a lot more time outdoors, and it leads to more exposure. With people that are of more Caucasian background. If you're from Sri Lanka, darker skin, then these people are through generations of naturally acquired darker skin pigment. And even our Indigenous Australians very rarely get melanoma, but if they do, it's on their soles of their feet or the palms of their hands that are basically pink.
So we're still susceptible to receiving it despite the melanin content.
They're much lower risk. But for people from Europe and coming here to Australia, so over 6 series of generations that are still here and should be still living in it.
Yeah, exactly. And I guess us, you mentioned Queensland having quite a high risk.
Correct,
just because we're in Victoria, does that mean we're much safer? Or?
No, not at all. And when I was working at a clinic at Hobart, I didn't think I was going to see much, but there were a lot of farmers that we saw, and I finished off seeing something like 50 cancers. So I detected over a period of 6 to 8 weeks.
Yeah, wow. Across farmers, I guess, they're spending all their time outdoors, and I guess here it applies to a lot of tradies and athletes, lots of people that spend a lot of time.
We're still seeing roof tilers, guys in their 20s running around with a pair of shorts on, and no hats or sunglasses or.
Yeah, so I guess touching on that, does skin cancer, does it depend on your age, or is it something that can affect anyone?
Well, yes, it can affect anyone, but obviously the more exposure you get with time, and the greater exposure length will increase your risk. So if you're going to be a teenager and spend a lot of time in summer getting sunburnt, it's certainly going to increase your risk of basal cell carcinomas when you're later on, in your 30s and 40s, and 10 to 15, 20 years later.
Yeah, I mean,
that's why we're trying to get the message over, and we're starting to see that now with people. Melanoma under 40 the incidence is falling. We are gradually getting that public health message over.
Do you feel like you get enough young people come through for skin checks? Or?
No, we're not. Nor are we getting the message over to about self-awareness of skin and doing their own skin checks. And only a couple of years ago, I had a 29-year-old guy who had a spot in the middle of his back. Luckily, his girlfriend picked it up and came to see me. He had a nodular melanoma, which was very rapidly growing. It was not even 3 millimeters in diameter. It was already invasive. But luckily, we got onto it early. And, through my management.
Yeah, I mean, 3 millimeters doesn't sound like a lot, but you can see the damage that it could have caused, right? It's about the prevention, early detection.
Melanoma, nodular melanomas, 18% of all melanomas are. That can kill people within 2 or 3 years and not even be more than 5 millimeters in diameter. So don't wait till it gets to a quarter inch. Or,
that sounds scary when you put it like that. Yeah,
absolutely.
So I guess for someone that someone that's listening that hasn't had a skin check before, even me included,
correct.
What's involved in a skin check, and what's the difference between a spot check and a full body check?
Yeah, well, a spot check is something where you've identified a lesion that you've been, because it might have been sore, changing, or abnormal and new. That I would welcome you to come and have it looked at, but I would prefer initially to have a full body skin check so I can see what sort of do a risk assessment, taking a past history of your general history, your family history, your occupational history, UV index exposure, how much time you spend outdoors, what your knowledge of in terms of slip, slap, seek and slide, prevention of and what efforts you have made. Then I do a full body skin check from head to toe, looking for a number of lesions that you have of the congenital type or acquired type, neither, so I can do a risk assessment for you, and whether you're a low risk or medium group or high risk, and that would then determine how often you need to be having a skin checks, or is it your own self-surveillance that is only required.
Yeah, and that's something you'd obviously advise a patient based on the risk that you're seeing that patient with the history taking.
We don't need to do a full skin check every year unless you've got a previous skin cancer
or a family history.
Family history.
Yeah.
Or if you've got something called dysplastic nevus syndrome, where you've got over 100 plus lesions, which are certainly in considerable increased risk for developing melanoma.
Wow.
So something where you might not even suspect that it's a problem. And that's come through 30 years of a lot of training and a lot of experience.
Yeah, absolutely.
And that's why I'm accredited with the Skin Cancer College, having done one of their extended courses of diploma and becoming accredited as a skin cancer doctor, which is about 700 or 800 in Australia.
And of course, you've got quite unique tools and equipment that you use to assist you with these.
We use is called a Melanoma. There are cheap ones out there, but I use one which is one of the best quality ones are out there. And these are specialised optics with polarising light and different colours that we use. But it's a matter of learning how to interpret what you are seeing with the dermatoscope in terms of interpreting the colours and the structures you're seeing under magnification and under polarising or non-polarising light and contact dermatoscopy. And this is like learning any other language. It takes considerable time to learn to be proficient at it.
Yeah.
You can't just learn it over a couple of weekends or something like that.
Or a single podcast.
No, that's right. And even the professor at the Uni of Queensland saying he doesn't recognise anyone to be experienced of dermatomas without 10 years of experience under their belt. I got 30 years.
Yeah. Well, I mean, it all sounds really complicated. There's a lot to unpack here, and it's definitely more conversation we should have around this. But just as a general, just as a closing topic, what are some 3 simple rules you can provide to the general public that can help reduce the risk of skin cancer?
Well, one is to be aware of the sun index, and you can get an app on your phone. And applying the principles of slip, slop, seek and slide. It's just not about sunscreen alone. And the third thing is doing self-surveillance and looking for something that's sore, changing, abnormal or new, something that the Skin Cancer College has developed rather than the ABC rules that the previously has been advised by the cancer councils, which we find that they're actually throwing out the door because it's actually missing quite a lot of skin cancers, particularly the amorphic or the ones that morphic cancers or the non-pigmented type melanomas. They're called amelanotic melanoma. That misses the ABC rules, but we pick it up on the scan because it's sore, changing, it's abnormal, and it's new.
Yeah, okay. So just to summarise that, the first one you said was surveillance. So come and get a skin check.
Correct.
Go see the GP and get
seeing
something.
a GP that it's a member of the Skin Cancer College
accredited.
has got that training.
Absolutely. Well, thank you, Dr. Ross, for giving us a small insight into what it is that you really do, and joining us today on the podcast. And
Be my pleasure.
For the listeners on the mend, until next time, stay well, and remember, keep on the mend.